Signs and symptoms of Alzheimer's disease. The main signs and symptoms of Alzheimer's disease are memory loss, mood swings, impaired judgment, personality changes, gradual loss of sleep, trouble sleeping, and difficulty performing familiar tasks. The 7 stages of Alzheimer's disease. Stage 1, no impairments. In this stage, the symptoms of Alzheimer's are undetectable. Stage 2, very mild decline. You may notice very minor problems. Sometimes you won't see them at all, but most of the time you may notice very minor problems. Stage 3, mild decline. Your memory and cognitive problems will become noticeable. Not too noticeable, they'll just be noticeable. Stage 4, moderate decline. You will experience the normal symptoms of Alzheimer's disease during this stage. Stage 5, moderate severe decline. You will need help completing day-to-day activities. Stage 6, severe decline. You will need constant supervision and professional care in this stage. Stage 7, very severe decline. This is the near-death stage. You'll no longer be able to respond to your environment nor communicate. It's a very sad stage. Parkinson's disease. Parkinson's is a neurodegenerative disorder that affects movements. It is a progressive disorder, meaning that it worsens over time. The symptoms can start with just an undetectable tremor in just one hand. During Parkinson's, your nerve cells, also known as neurons, die. Parkinson's mainly affects the nerve cells located in the substantia nigra, which is this part right here. Now, the neurons located in the substantia nigra produce a very important hormone called dopamine. Dopamine is a neurotransmitter that plays a very important role in how your body moves, in your movements. So due to the dopamine producing neurons dying during Parkinson's, you will start to lose the ability to move your body or be able to control your emotions. So basically movement and every important part of the body will start to deteriorate. Currently, there is no cure for Parkinson's. However, doctors have come up with medications that can treat and reverse the symptoms of Parkinson's disease. So, in this picture here, this is a healthy patient and a Parkinson's patient. So these blue things right here are the neurotransmitters called dopamine. They are the important neurotransmitter that you need for body movement, as I said earlier. In a healthy patient, more of it is being produced because there are more dopamine producing neurons. Because there's less dopamine producing neurons in a Parkinson's patient, movement will be affected. As you can see, look, less of these purple dots, meaning less dopamine and less body function, such as movement. Physical symptoms of Parkinson's disease. The main physical symptoms of Parkinson's disease are tremors, rigid muscles, loss of autonomic movements, postural instability, weakened face or throat muscles, troubles with sleeping, speech, and writing problems. So this is someone with Parkinson's. He's having repeated tremors in his arms and his legs and persistent tremors in his hands. Cognitive symptoms of Parkinson's disease. The main cognitive symptoms of Parkinson's disease are depression and anxiety, loss of your main executive functions such as decision-making, controlling emotions and planning, trouble thinking properly, and speech problems. Multiple sclerosis. Multiple sclerosis is an autoimmune disease that affects the brain and the spine, also known as the central nervous system. MS affects about 1 in 1,000 people. It usually appears between the ages of 19 and 41. So during multiple sclerosis, your immune system attacks your myelin. Now your myelin is a protective sheet of your nerve fibers and your neurons. It plays a very important role in the communication between your brain and the rest of the body. So due to the myelin being damaged by the immune system, you will experience problems will occur between the communication between the brain and the rest of the body, resulting in muscle spasms and weakness. There are 4 main types of MS. The 4 main types of MS are relapsing remitting MS, secondary progressive MS, primary progressive MS, and progressive relapsing MS. Normal nerve fiber and myelin sheath versus MS nerve fiber and myelin sheath. So in a normal brain, the myelin sheath is not damaged. It's perfectly there, protecting the nerve fiber and the neurons. In a multiple sclerosis brain, the myelin is damaged, leaving the nerve fibers and neurons to fend for themselves. Now, because the nerve fibers and neurons have to fend for themselves, they'll eventually deteriorate and become permanently damaged, which affects your movements, causes muscle weakness, and much more. Different types of MS. Relapsing remitting MS. Relapsing remitting MS is the most common type of MS. About 85% of people with MS have this type. People with this type of MS will experience their first symptoms in their early 20s. After they experience their symptoms, they will go through something called relapses and remissions. Relapses are periods of where the symptoms become very severe and you become very sick. Remissions are when the symptoms are gone and it is less severe. It has calmed down. Everything is calmed down. You're like a normal human being. Relapses and remissions can last for days, months, and years. Secondary progressive MS. In secondary progressive MS, the symptoms worsen over time. Many people with relapsing remitting MS will eventually transition to this type of MS later on in their life. Primary progressive MS. Primary progressive MS is an uncommon type of MS. Only 10% of people with MS have this type. During PPMS, the symptoms slowly worsen over time. Slowly worsens. There are no relapses or remissions during primary progressive MS. Progressive relapsing MS. This type of MS is a very rare type of MS. Only 5% of people with MS have this type. People with this form of MS will experience no relapses. They will not get any relapses. The symptoms will steadily worsen over time. Steadily worsen over time. Symptoms of multiple sclerosis. The main symptoms of multiple sclerosis are fatigue, depression and anxiety, muscle spasms, muscle stiffness and weakness, vision problems which can go from partial to complete loss of vision, walking problems, slurred speech, numbness and weakness in your limbs, tingling in parts of the body, and loss of sensation. Migraines. A migraine is a genetic neurological disorder characterized by painful episodes of headaches called migraine attacks. These migraine attacks usually occur on one side of the head. They usually last from 2 hours to 3 days, depending on your situation. About 30 million people in the United States have migraines. More women have migraines than men. Symptoms of migraines. The main symptoms of migraines are frequent vomiting and nausea, speech problems, moderate to extreme sensitivity to light, sounds, and smell, blurred vision, and pain in one or both sides of the head. Stroke. A stroke is a very harmful medical condition that is taken very seriously around the world. A stroke occurs when blood stops flowing to the brain, resulting in brain cell and tissue death. Now, the reasons the brain cells die during a stroke is the brain cells need blood for oxygen. Without blood, they will not be able to survive. So due to the extreme shortage of blood supply to the brain cells, they'll eventually deteriorate and die. Strokes are the 4th leading cause of death in the United States. About 800,000 people every year die from stroke. The main types of stroke are ischemic stroke, hemorrhagic stroke, and transient ischemic stroke. Symptoms of stroke. The main symptoms of stroke include speech difficulty, sudden numbness, sudden headache, trouble seeing in one or both eyes, and trouble walking. So, visual representation of what happens during a stroke. So, in a normal body, there will be normal blood flowing through the brain, nothing blocking the blood from going to the brain. During a stroke, a blood clot located in the blood veins block the blood, making the blood unable to get to the brain. So this is a picture of a man whose brain is deprived from blood, resulting in his brain tissue and brain cells dying due to lack of oxygen. Conclusion. The brain is a magnificent organ that controls all the parts of your body. Sometimes the brain can run into issues causing neurological problems. Throughout this presentation, I have discussed the main neurological disorders of the brain and the nervous system. Alzheimer's, Parkinson's, multiple sclerosis, migraine, and stroke are all horrible diseases that need to be cured immediately. I, as a successful neurosurgeon, will assure that these diseases will be cured. I'll make sure that these diseases will be defeated by Dr. Nana-Kwabena, Bilson, Darku. Thank you for watching this presentation, and I hope you enjoyed.